Hi, I'm Dr. David Samimi, oculofacial plastic surgeon at Eyesthetica, and today I'm going to talk about a condition that patients usually refer to as cheek bags and physicians call malar mounds or festoons. Now, this is an aesthetic problem that's very bothersome to patients, and it's a bit of a challenge for aesthetic providers to treat. So I thought I'd take some time to explain to you why we get these kind of cheek bags, what the treatment options are, and how I approach it, and then what are the recovery and the risks of treating this condition. So first of all, most patients think that they see this kind of bag somewhere on their upper cheek and they say, oh, this must be fat. Most bags around the eyes are fat, and so take the fat out and that'll treat it. But it's actually a little more nuanced than that. And I try to explain to patients about the way the face is structured, really with ligaments that are kind of suspending the skin and muscle to the skeleton. And we have two sets of ligaments that are relevant in this area. Here's an image of the face, and you can see that there's a ligament along the orbital rim called the orbital malar ligament, and that's kind of what supports the lower lid to the skeleton, and above that is where you're seeing usually kind of herniated orbital fat bags. And down below, kind of mid-cheek, there's something called the zygomatic cutaneous ligament. And there is a space, as you see, that's in between those two ligaments that really does not have a lot of muscle or other firm structures. And so it kind of acts as a sponge. It's this potential space that wants to expand at times. And as the face is aging, it becomes more and more prominent. In some patients, they're more likely to have it genetically. And in other patients, it starts happening with age as we lose some collagen and soft tissue. Now, there's really two types of these bags. One would be the wet festoons or malar mounds. These are ones that absorb fluid and kind of get a bit swollen. And then the other ones are dry, where it doesn't really absorb any kind of water or fluid, but it's just always there as a secondary cheek bag. So let's look at a few different examples. Here's a patient where you can see that she has a little bit of kind of herniated fat, pooching fat up above, but then if you look closely, there is this secondary bag, which is along the cheeks, and that's the festoon or malar mound. And you can see superimposed on this photo next to you where those ligaments are located, and you can see now how there is this compartment that forms because it's between those two ligaments. Hers was the wet type. This is a more subtle version. You can see that there's eye bags above, which is with the fat, and then there's the festoons below, which can look very subtle in a picture, but patients notice it and it kind of waxes and wanes and might get worse with poor sleep or having a very salty meal, for example. These ligaments are in different configurations. Sometimes they can be more in parallel like before, or here kind of more in a triangular shape if you see like this. And so when you look at this face, you see there's more of kind of a triangular secondary bag here on this patient, which is an example of kind of a dry malar mound. So let's talk about what the common treatment options are. Well, non-surgically, there's kind of creams like Preparation H, which patients put on, which might help to some degree a little bit. There are some other polymers, these are glues, something like Plexiderm, where you put it on the skin and it kind of tightens things up, actually pretty significantly for a few hours, but patients have mentioned that it's very difficult to then put makeup over that. So it has some limitations and it's not a more long-lasting treatment. Other minimally invasive treatments then are these treatments which apply energy to that space to kind of tighten it. These are things like Profound or Morpheus. It's called radiofrequency microneedling. A matrix of needles is put into the skin and some energy is put between those needles, and then the deeper tissues, soft tissues, are kind of tightened a bit. The benefit on that is that it's pretty safe in all skin types. I think the risk of having something bad happen is very low, but the downside is the treatments can be very conservative, and in some patients, they don't really see much of a result. And so you have to understand that going in when you're going to consider spending the money. Other treatments are laser resurfacing. That's where you're doing a controlled burn of the skin, and when you're trying to treat festoons, you'll actually do that much deeper. And so patients can have a prolonged recovery where it looks like you have a very bad sunburn. And if you have pigmented skin, then you have the risks of having pigmentary changes. which can make that treatment option a challenge. Now, the next set of treatments is really what I found in my hands to be most effective for the long term and to give a more robust result. So the way I most commonly take care of these conditions is through a combination of a few procedures. Number one is usually what's called a skin pinch. That's where I pinch a little bit of skin in an area hidden right beneath the lash line, usually hidden into the smile lines. That way the skin is cut out and the skin is tightened and lifted a bit. At the same time, I'll also go a bit deeper and I will do what's called a cheek lift or a mid-face lift, where I take the muscles of this cheek and ligaments and I'll kind of lift them and resuspend them up a bit. So now you've tightened the skin and the deeper soft tissue structures to kind of give the cheek some support. The third thing that I'll do is if there's any herniated fat, kind of fat bags up above, I'll address that either by going on the inside and taking out a little bit, or more commonly, taking that fat and repositioning it from the inside, moving it down to kind of fill that hollowing in the lower lid cheek junction. And then the kind of magic and secret sauce that I found over the last decade of experience is restoring some of the lost collagen and volume with your own body. And that's with something called fat grafting. That's where I harvest a little bit of fat from elsewhere in the body, and I use that to inject as kind of a natural filler to restore the places of the face that have been lost with age. And the beauty of it is the face ends up kind of perking up and looking more natural. But the way I kind of think of it is that filler, that fat acts as kind of a natural glue to kind of glue those different compartments together that I was showing you based on the ligaments of the face. And so you don't see those different compartments. You're not seeing the scaffolding as much because that glue has helped kind of camouflage it together in such a natural way because it's your own body. Here's a patient that had a moderate sized triangular dry festoon. You see here, she has kind of two sets of bags, one set of bag above, which probably is a little bit of herniated fat, and then this other one down below, which is triangular. In her, I did this skin pinch, cheek lift, and fat grafting. And you can see in the after picture, the lower lid cheek junction is much smoother, more natural looking. And if you pay closer attention, her whole face looks better because when I add the fat, I usually add it to the kind of lateral cheek, temples, and brows. And in this picture, you start seeing her lower face looks heavier. That's kind of where your eye is drawn towards. In this after picture, your eye is drawn towards the more youthful, aesthetically pleasing parts of the face, which is the cheeks and the temples and the brows, because that's where the volume is added. Here's the same patient in the frontal view. You can see both sides where she has these dry festoons or malar mounds and how much smoother and nicer and natural looking she is after the fat grafting is kicked in. Here's another patient that has these wet malar mounds, and he also has multiple kind of deep wrinkles in the skin above that, and you see him here afterwards about 9 months. In this particular patient, I did a combination of skin removal, fat grafting, cheek lifting, and I did do a laser resurfacing because there were such deep wrinkles up here to kind of help improve that. Now let's talk about the recovery and some of the risks with doing this procedure that I do on these patients. So recovery is for the most part similar to most eyelid and facial surgeries, where patients are going to have obvious bruising and swelling, usually around 2 weeks. However, I've noticed that in patients that have this predisposition for having a cheek bag, that sometimes they can have extended swelling in that area for 1 to 2 months afterwards, which is a little longer than usual. The other thing to note is that the effect, the magic really of the fat grafting really starts to take effect at month 6 to 12. So in some ways, it's kind of nice as the clock is going, you're actually getting younger, but in other ways, it does take a bit of patience. I think the biggest risk with this procedure, however, is that when we're trying to achieve results that are safe and natural, we really can't promise eliminating these secondary cheek bags. And I usually say, depending on what your anatomy is to start, I can usually, if we do all these procedures, can get at least a 75% improvement that is relatively long-lasting, more long-lasting than most other procedures. I'm really excited that I got to share kind of how this condition exists so that hopefully you can understand it better, and B, what are the most effective treatments that I found in my hands that can help you with this very challenging issue. Hopefully I'll have the opportunity to discuss with you in person, and I look forward to meeting you.